Hello everyone, welcome back to this MLA content map walkthrough. Today we're going to walk you through perioperative medicine and anesthesia. Now, a lot of these conditions you would have seen in other topics, but in particular, these conditions will be in the context of perioperative medicine and anesthesia, okay? So acute kidney injury, right? This may be because the patient has had a ton of blood loss, the patient has hypoperfusion in case of surgery, right? Um, and you should know the investigation interpretation in these cases. So RFTs, you should know how to read them and how to figure out the patient has acute kidney injury. Next, you have anemia. In particular, in these cases, the patient may have had a ton of blood loss, or, well, I mean, the patient isn't going to have a ton of blood loss and then eventually end up with anemia such acutely in these cases, but more so, the patient has anemia before the surgery, and you need to treat the anemia before you go for surgery. That's how these cases show up. So know how to interpret investigations, how to figure out what kind of anemia the patient has, how to treat the patient so that the patient can undergo surgery. Next, we have anaphylaxis. This may show up in the case of a blood transfusion scenario. It may be an emergency scenario, a simulation or a simulation mannequin scenario where the patient has life-threatening anaphylaxis and you need to give the patient adrenaline or an EpiPen, and you need to stop blood transfusion in these cases. Next, we have aortic valve disease. Know the presentation of this. This is something that may be relevant in the case of anesthesia assessment, if the patient is fit for surgery or not. Next, you have arrhythmias. This is something that you should know about in the case of emergency scenarios. So supraventricular tachycardia, that is something the patient may have. The patient may have an atrial fibrillation. They may be on blood thinners, so that is very pertinent in surgery cases. Okay, so do it in that context here. Next, we have asthma. Asthma is important because the patient may have exacerbation of their asthma. Okay, know the drugs for asthma. Okay, um, in particular in these cases, it may just be an exacerbation of their asthma. Next, we have cardiac arrest. This is very important. Know BLS. Okay, really know BLS well. And next, you have cardiac failure. In these particular cases, the patient may have an X-ray with fluid or edema in their lungs, and the patient may have cardiac failure before they undergo surgery, so you need to know what you're going to do in those cases, know the drugs the patient may be taking if they have cardiac failure, and some other kind of conditions, so if they have comorbidities like arrhythmias. Next, you have chronic kidney disease, know the difference between acute and chronic kidney disease, the investigations. And next, you have chronic obstructive pulmonary disease. Exacerbation of this may show up in your exam as an emergency scenario. Next, you have deep vein thrombosis, very important in the case of surgical scenarios because you need to give the patient stockings and give the patient blood thinners because the patient tends to develop clots in their legs. So you might have to counsel the patient, okay, tell them about deep vein thrombosis or take a history and figure out if they've had deep vein thrombosis before or if they are at risk of developing deep vein thrombosis. That's very important for surgery. Next, we have dehydration. Again, another very important thing. Fluids are very important when it comes to surgery. So yeah, so just know the fluid management in the case of surgery, preoperative, perioperative. Next, you have diabetes mellitus, and of course electrolytes as well. The patient may actually show up with deranged electrolytes, so know what you're going to do in those cases. Next, you have diabetes mellitus type 1 and type 2. Know what you're going to do about the drugs the patient is taking for their diabetes in the case of surgery. Which drugs you're going to stop, which drugs you're going to continue, how you're going to start them on the drugs they were previously taking before the surgery, know about all that in surgical scenarios. Next, you have drug overdose. Drug overdose is important in the case of paracetamol overdose. That usually shows up in your exams. Some other kind of drug overdose like opium or cocaine may also show up. So just know the different presentations in those cases and how you're going to manage it. In your OSCE stations, I've only seen paracetamol show up more frequently. I haven't seen other kinds of uh, drug overdoses show up, but opium overdose may show up. You know, you may get pinpoint pupils when you're looking at a patient in the case of an emergency scenario. Just know what you're going to do in those cases. Okay. Next, you have epiglottitis. Important to know the organisms, Haemophilus influenza in the case of children, may be sniffing position. The patient may be in a sniffing position, search that, look at that. Look at pictures of the throat, look at pictures of the epiglottis, right? Those may come in your multiple choice question exams or your OSCE stations. Drooling, dysphagia, dysphonia, right? Um, Distressed breathing. This is how those are the 4 Ds of epiglottitis, right? Know all about that. This may show up in your exams and your multiple choice questions or your OSCE stations. Essential or secondary hypertension in the case of surgery scenarios. Know that the patient might have to have their surgery delayed because they have hypertension and their blood pressure was higher than what you would want, or also know what kind of how you're going to manage the drugs of the patient, right? If you're going to continue them, if you're not going to continue them in the case of surgery. Next, you have gastroesophageal reflux disease. Um, this is something that you'll study quite extensively in other topics as well. So just know that you're going to give the patient PPIs, of course, and how you're going to manage these cases. Next, you have intestinal obstruction and ileus. You'll study this in surgery. Abdominal exam is something that you'll go for, but the patient won't let you because the patient will be in extreme pain. Look at x-rays of this and know that post-surgery, the patient may get intestinal obstruction. And know how to explain this to the patient as well, necrotizing fasciitis. This is something that they might show you a picture of, right? I haven't seen this show up in your OSCE stations as much, but definitely look at pictures, know how the patient is going to present, know how to counsel the patient. Obesity. The patient's surgery might be delayed because they are obese. Know how to explain that to the patient. Okay, they might be having surgery because of their obesity, so some kind of gastric bypass surgery. So in those cases, know about obesity, know the normal ranges of BMI and all the different ranges and what treatment they call for. Okay. Next, you have obstructive sleep apnea. The sleep clinic, right? Mandibular advancement devices, CPAP, right? Know how you're going to manage this. In these cases, you'll probably have to advise of weight loss to the patient as well. DVLA is very important in these cases as well. Next, you have patient on antiplatelet therapy. This is very important in the case of surgery. Know how you're going to manage blood thinners in the case of surgery, if you're going to continue them, if you're not going to continue them, if you're going to change them, how you're going to bring the patient back on the blood thinners they were taking before surgery. Placenta previa. This is a topic that definitely shows up in your exams, multiple choice questions, or OSCEs. Look at pictures, know how to draw placenta previa for the patient, know how to explain it to the patient, know what to tell the patient about sex, okay, about intercourse, if they can have it, if they can't have it, if they should stay away from it, if this will reverse or not. Remember to ask the patient if they've planned something for the birth. So yeah, placenta previa definitely shows up in your exams, especially OSCE stations. Placental abruption may show up as an emergency scenario. Haven't seen it show up as commonly in your OSCE stations, but that doesn't mean it can't show up. So do it well in that case as well, but definitely shows up in your multiple choice questions. Postpartum hemorrhage in an emergency scenario. We've talked about this in your surgery section as well. Yeah, so just do it really well in the case of emergency scenario. Uh, it may show up as an atonic uterus. The nurse may have called you in and tell you that the patient has had a birth and now they're hemodynamically unstable. Do it in those cases. Okay, know what you're going to do for a patient with postpartum hemorrhage. Next, we have and know about oxytocin as well in these cases. Next, we have preeclampsia and gestational hypertension. Know the difference between the two. Know the management. Okay, know how you're going to manage the patient. Know that you're going to admit the patient in the case of preeclampsia. Know that you're going to get protein in the urine. Always do a urine dipstick. Very important. Very commonly shows up. Respiratory arrest. In these cases, know what you're going to do. You're going to call anesthesia, right? Maybe you'll have to start the patient on mechanical ventilation. Respiratory failure, right? Know the causes of respiratory failure. Okay. Next, you have sepsis. The sepsis 6 is very important. They love to test you on sepsis 6. Okay, give 3, take 3, all that stuff. This is really important in the case of sepsis. Next, you have substance use disorder. Know that you need to take a history of substance use before the patient undergoes surgery or goes for anesthesia. And next, you have surgical site infection. May show up as an angry patient who's angry about the infection they have in their wound, and they say that it's your fault, and you have to explain to the patient that it's not. really anyone's fault in particular. It's just that these are complications that are inherent with that come with surgery. Okay, know the antibiotics that you're going to give the patient in these cases as well. Know how you're going to counsel the patient. But this is very similar. All of this is very similar to surgery. Okay, to the topic of surgery. So you'll cover it there as well. But I hope this helps.